Hello and welcome to CAPC's Fast Five. Today's topic is planning and replanning in periods of uncertainty, such as this COVID era. My name is Tom Gualtieri-Reed. I am a CAPC consultant, and I also work extensively with programs in all settings across the country. I'm very pleased today to have my wonderful colleague, Donna Stevens, the Program Director of the OACIS Palliative Medicine at Lehigh Valley Health Network in Northeast Pennsylvania. Donna, would you mind providing a little background on yourself and your role?
Yeah, hi Tom. So glad to be with you today. I've been doing palliative care administration for about 14 years now here at Lehigh Valley. Our network includes 5 hospitals, and as you say, in Northeast Pennsylvania, we have a full integrated palliative care continuum with a home-based team. That's a major part, and I am part of a dyad leadership here with my clinical partner, the chief.
Excellent. The dyad relationship's probably been very helpful in the planning process. So
Absolutely.
today, Donna's going to spend some time sharing her approach with us about how she took time to engage leaders and influencers in this process of planning during this uncertain period. So Donna, teams have been experiencing a mix of issues from stress and exhaustion to financial uncertainty, and then some pressures to continue to grow and meet those growing needs. What was your experience and what led you to deciding to replan at this time?
As you say, there was so much uncertainty going on and fear of exposures, along with, what was the financial picture and where were volumes coming from. But we decided that we were going to lean into this uncertainty and really figure out what could we do now, and not spend a whole lot of time, thinking about it as much as what could we enact now. And thinking through how we were going to champion others' goals along the way and demonstrating we were part of the solution. So within that, it was these guiding principles that kind of helped us. One was, how can we benefit the most, whether it was most patients, the most stakeholders, whatever the network need was, but how can we benefit the most? Coming up with different options, as we were talking about the plates shifting all the time and really life being different one day to the next, we needed different options. So come up with several different parts of whatever path we were laying out. And really looking for new stakeholders that needed us to, further that need. And what we came out with was really meeting a need in the emergency room to assist with the surge that was potentially happening here through, earlier goals of care discussion, advanced care planning. And the last guiding principle really was, along with the rest of the world at that point, is maximizing technology. And so that was kind of how we looked at whatever we were doing during this time. But a lot of things did change during that time.
3 things I heard, certainly relationships and making sure you're aligning to those, developing
Yes.
options around what you might do, and then showing and flexing yourself and adapting to what the changing needs were. What
Absolutely.
were 1 or 2 barriers that you were hoping to address in the planning process?
Yeah, so not many things turn out like you think they're going to when you go into them. And we had some turnover by virtue of shifting these resources to the emergency room. So some vacancies weren't really in the plan. And so we had to retract and really manage the work differently once we were feeling some of that turnover impact. The other one was the use of technology with this population got to be a real barrier for us. And so we applied for a grant during the COVID times to partner with Apple to try and figure out not only access, but also device need of a very vulnerable population to engage with healthcare better.
Great. So what was in your plan? What were the component parts?
So the things that we really focused on with the plan itself was the area of access, or the point of access that was in need of more palliative care, the resources needed, what was the tangible benefit, what was our impact going to be realized pretty quickly, and who are our major stakeholders and how could we meet their needs as well.
So you leaned in this period, you presented your approach. What was the outcome?
Yes. The outcome was we did get budgets reapproved for the next year, which was a sizable feat. We secured new resources along the way in terms of meeting greater need. And we also developed new partnerships that to this day are really assisting with some political capital.
Great. Donna, thank you so much for sharing. For those that joined us, hopefully you heard of some good examples of tips to help you in your planning. Thank you, Donna.
Thank you, Tom.
Take care.
Have a great day.